Thank you, Mr. Chairman. And good afternoon again, everyone. We're so happy to be chairing this panel that has a lot of persons who are not just good in terms of the knowledge of technology solutions, but they've actually walked the walk as well. And I know there are two on your program, but there are three panelists that we will have to present information on just how technology can provide opportunities for us to better our health and wellness offerings. If you just think about it, any industry, just the pace at which technology is impacting our lives now, most of you, if you really assess it, you would have spent more of your hours today with your heads down in your devices, yes or no? I can see a few of you right now. And that's just the nature of it. I mean, I grew up in the era where you didn't even have internet. And I know I'm aging myself right here. But just to consider, in fact, just yesterday or the day before, I believe Flow and Digicel are having some problems, and I've had to go without actual internet connection or phone connection. And you start really immediately felt the challenge just going about your day. So we see where anything you do, any advances that you make, if there's not a technological component, then you are going to be missing out on the opportunity. My children alone, they spend, I swear, 90% of their days on their smart devices. And that's what we will see in the world. We're seeing now in the world today, and I'm sure it's going to get, I don't want to say worse, but it's going to get increasingly so tomorrow. So how have we seen technology impacting the health and wellness industry? We have you see our own Jam COVID has provided a way for us to use GIS mapping to track visitors who are here and know where their whereabouts and so on. We've seen where in the fitness apps and these watches that you wear now, they can tell your heart rate, they can tell you, how well you are breathing. They have sleep wearables where it tracks your movements, your respiration during your sleep to determine just how well and to guide your sleep routine to make sure you have better rest. Of course, there are apps that can get a lot of biometric information to guide the experts in making better decisions. There are thermal devices used to determine the knots in your bodies to then guide the masseuse to then get to the exact spots where your body needs the massages. And so there's a variety of solutions out there already. And what we're going to do now is have our panelists tell us just about some of the ones that they are doing and other opportunities that may be out there. So today we have Dr. Shay Bowen, and he has an app called MD Link. He's going to be here in person. In fact, I see him coming up now. And we will also have Professor Winston Davidson from UTech. We heard him yesterday. We benefited from his expertise, and we'll get more from him as well. And we have Ms. Terry-Ann Sigri, who is from the IDB, but in the department where she looks at innovation and supporting design and developmental projects in Jamaica, Bahamas, and Belize. Shay is here in person, and both Professor Davidson and Ms. Terry-Ann Sigri will be on the screens. So we're talking about technology, and we're using technology in talking about technology. How good are we? A hybrid. So what I'll do is I'll just, in similar fashion, go through each panelist with allowing them their 10 minutes to discuss the topic, technology solutions as drivers of health and wellness tourism. And Ms. Sigri, I hope you forgive me today, but it's International Men's Day. So for the only time, the only day in the 365 days, I'm going to allow the men to go first. And since Dr. Shea is in front of us, I'm going to allow him to go ahead and go first.
All right, great. Thanks for having me. Everyone can hear me okay? Great. So I agree with you in that when the coronavirus hit, technology is what saved us all from every aspect, whether it was health, finance, every aspect. It was the only way we were able to survive. Luckily, what we had done, we launched a telemedicine platform back in 2017, and it was gaining a lot of momentum. In fact, we had tourists from a lot of the hotels use the platform. 2017, before coronavirus, they'd come on and use the platform. And then coronavirus came, everyone realized that this was something needed, a necessity. It moved from a convenience to a necessity, and everyone was forced to see their doctor online. Stay home, social distance, see your doctor online. And that is in fact what MD-Link provided to Jamaica before and right on time when the coronavirus hit. It allowed doctors to become more familiar with it, more accepting to it, even patients. And of course, the tourism industry is the highest amount of, they are more advanced in terms of their digital experience, their digital expertise. So you get to learn that when they come to the Caribbean, especially now with coronavirus times, they want to have access to telemedicine services to be able to see a doctor and not be put at risk. And what we have done with MD-Link is we have continued to grow the platform. It has been gaining a lot of traction. In fact, we've partnered with international health insurance companies and other international telemedicine companies because they know when their tourists, their persons come to Jamaica, they're going to want telemedicine access without having to go into an actual physical office, be at risk. They might forget some medication at home and they can stay in the hotel room and get that delivered to them right there in their hotel room. So that's in fact what MD-Link has been doing for Jamaica and the Caribbean region, especially Jamaica, because we did launch here and we are focused here. Recently, what happened is that the IDB, they actually reached out to us and they helped us push MD-Link even further in that we were able to launch an artificial intelligence COVID screening tool, again, right here in Jamaica. At the same time, it was being launched in first world. So you have healthcare being launched or being advanced simultaneously in third world and first world, and that's never been really heard of before. So they were able to support us and help us launch MD-Lex, which is an artificial intelligence COVID-19 screening tool. It's free, and you can go on there and you can enter your symptoms and get some feedback, get some guidance and referral to the nearest health center, the nearest public testing center, or the nearest hospital, depending on your symptoms. It uses the algorithm to calculate based on the symptoms that you enter, whether or not you're high risk or low risk. And we have been having a lot of traction with that, a lot of users, especially since it has been free. And we have, in fact, been able to direct patients to the necessary institutions. We've had as much as 10 to 15 COVID-positive patients that have been helped from this actual platform. And it's continuing to grow. And as MD-Link moves forward into the medical tourism industry, even further forward, because as we know, coronavirus hit, and it did affect telemedicine as well, because the tourists weren't using it anymore because they weren't here. But we learned that for them to come back, they need to have access to this sort of first world technology, this ability to see a doctor online. And what we have been doing is offering packages, so health packages, health travel packages to the respective hotels, boutiques, the villas, the Airbnbs, and what that allows is that you can tell your tourist that's coming that, hey, we can protect you from a health aspect, especially in this pandemic, before, during, and beyond. And we've noticed that it's continuing to grow and grow and grow. And even from the plastic surgery aspects of things, telemedicine is playing a role in that you can pre-screen from Dominican Republic, from British Virgin Islands, and then you can come here and have your surgery done. So again, that's again how MD-Link will be advancing health technology and medical tourism in Jamaica.
Excellent. Wow, very interesting. I mean, I think you did it before 10 minutes. I'm going to jump in with a question right away because it's so interesting. I mean, how does it change the business model of the typical patient to doctor healthcare kind of thing? I mean, is it that the online, they swipe their cards, how they pay online? Is that how it works per contact with the doctor?
Correct.
The MD Link that's real doctors in person, but then the MD Lex is an artificial intelligence, so you don't even have real persons there anymore. Wow.
No,
so
it's guided by CDC guidelines,
right.
but there's no human interaction. And again, MD-Link is not meant to replace the health sector at all. It's more or less meant to complement and provide a hybrid healthcare service to persons. Yeah.
Thank you so much. Professor Winston Davidson, your 10 minutes on the topic.
I've sent my PowerPoint presentation, just 10 or 11 slides, so that in fact I can, so if it's projected, I will be able to see it. Let's see. I'm not able to see it just yet.
Well, it's the technology section, and so
okay,
they did better than yesterday, rightly so. In fact, in terms of upgrades, I noticed even your dress, Professor, the bow tie and all, you've stepped up a few notches today.
Well,
I noticed.
I usually am this way. Okay, what I'll do is I'll see if I can bring this up on my and I'll speak, and then they can speak to it. Okay.
The slides are up here.
Hello? Are you seeing the slides?
Yes, the slides are up here. The one titled "Value of Technology as a Driver of Health Tourism Services."
Okay. Fair enough. I'll begin that. The following factors are key drivers in the sustainable development of any health tourism services sector. First is the vision of a standards-led, market-driven, affordable, and sustainable national health tourism service system. It must also be user-friendly, customer-focused, also in their service delivery. What I'm talking about is just the value of technology as a driver, right, for health tourism services. I'm looking at some of the factors related to it. It must be easily accessible and affordable health tourism services for both local and international markets. And what I'm talking about is the vision of the application of telemedicine as a technology tool for delivering health services. Right? There must be integration of credentialed local professional competencies in the development, growth, delivery, sustainability, and international legal credentials of the national health tourism industry. In other words, it has to be driven also by persons who are credentialed, not as doctors. They must have, in fact, their license, or dentists, they must have their license, and of course, for the allied medical personnel, they must have their license. All of this is covered by law in the councils that we have in Jamaica. That is the Medical Council for doctors, the Dental Council for dentists, and for the allied medical personnel who will be involved very, very deeply in the wellness health tourism sector. Those must, of course, be credentialed. Now, what I'm saying is that the application, so therefore, the application of modern information and communication and technology systems, right? That is telemedicine, must also be integrated with three dominant health tourism markets. If you look at the health tourism market, there is what you call wellness health tourism. Wellness health tourism is what, in fact, is the domain located in the hotels. Medical health tourism, right, is what is located in the traditional medical hospitals, health centers, and doctors' offices. And retirement village tourism is what is referred to as a home health tourism sector, right? So these three are multi-billion-dollar markets. And what I'm saying is that any development of a telemedicine sector in this country, the use of this technology, it is so valuable. It has to be able, right, to integrate, even from a communication standpoint or referral standpoint. There has to be a relationship. And our research for 22 years has in fact been geared towards finding a solution that in fact could integrate with that. And the next few slides will show you exactly what we have been doing over the past 22 years in R&D and how we have integrated that and why we think that this is the most important aspect of our feature of our brand. Now, telemedicine as the primary driver in health tourism services delivery. What do we mean by this? Our model is called Doctor on Call and is a universally accessible and affordable health tourism delivery technology platform. And I'll explain to you what we mean by universal access and affordability. Because we attempted to do this, to get universal access to primary health care in 1978, from 1978 on. And we had expected that we would have had this particular feature for the Jamaican people by the year 2000. This was not to be. And so the whole idea, inspired by that, the absence of a universal, affordable, and accessible healthcare platform, the whole idea in the research and development thrust, in the vision of research and development thrust of Doctor on Call, was to try to find a way to have a universally affordable, acceptable platform so that everybody in Jamaica would have access to it. And based on our research, we discovered that for this to happen, we need the services of a core group of three professionals. One, the doctor, two, the dentist, and three, the allied professionals, allied medical professionals. Now, most of you don't know exactly who is an allied medical professional, but as I go on, you will be able to see. I mean, nutritionists, physiotherapists, psychologists, counselors, you name it. And also public health inspectors and public health personnel, like occupational health and safety officers. These are all part of what we call allied medical professionals. And they have a council, and they also have to satisfy international standards. And so therefore, these are the three core groups, right? The first two, doctors and dentists, right, are able to write prescriptions. Allied medical professionals are not able to write prescriptions, but they also do work very closely with these professions, right? And so therefore, it is not a problem for the referral to take place between them. Now, how does Doctor on Call work? How does it work? All certified members of these three professions will be able to use the platform free of cost. I mean, you ask, how are they able to use the platform free of cost? This is possible because the telemedicine researchers contributed the cost of 22 years of R&D as a dividend to the platform. In other words, we rolled in all the costs, including our sweat equity, to contribute to the platform. Also, the Jamaican doctors who participated in user acceptance tests during the past 20 years have given a commitment to set their fees. In other words, each doctor has to set his own fee, but each doctor will set their fee for service to the patient at a half or less than a half of their normal office visit costs. So if the doctor charged $4,000 to see the patient, he will charge $2,000 to see the patient online. And that we consider to be a principle that the doctors abuse. And so therefore, he's also giving a dividend to the platform. And why do we give this dividend to the platform? So that it would be affordable. In other words, instead of the person in the rural district jumping on a bus, spending a lot of time, coming to see the doctor in his private office, he pays $5,000, but he also has to pay taxi fare, he also has to pay lunch money, etc., etc. So therefore, you can see how the patient is able to see the doctor more often and quicker.
Sounds fantastic, Prof. We'll get back to you in the question and answer section because your 10 minutes are up and we want to get to Ms. Sigri. So great to see not just research done on what's needed out there as far as technological solutions for health and wellness, but actual products created. Doctors on Call, and in your case, Dr. Shea, MD Link and MD Lex. And you mentioned, Dr. Bowen, that IDB came and worked with you. So I'm assuming you guys know each other very well, Ms. Sigri. So I'm going to segue into your facilitation of entrepreneurs and in the medical field who have created these technology solutions. And if there are any other avenues where those who are not already down the wicket like these two esteemed gentlemen here in the panel, but would want to look at opportunities for technological solutions for the health and wellness sector, where those might be.
Sure. Thank you for the opportunity for speaking today. I'll try to keep it under the 10 minutes that was given. I just wanted to start by speaking about the support that Dr. Che mentioned around us providing support to MD Link platform. So IDB Lab is a part of the Inter-American Development Bank Group. We are the innovation lab of the group, and we are the entity that really looks at innovation and technology and trying to drive economic change by testing new solutions and harnessing entrepreneurship and new technologies to do exactly that. In our efforts, we try to catalyze new industries. So I'm very happy about whole conversation today about health and wellness tourism and coming up with new business models that will create jobs and improve productivity of the small firms that already operate within the space. And to also expand the products and populations. And COVID-19 has really shown us that a lot of people are vulnerable. Though we never looked at them as vulnerable. IDB has coined the term to talk about the silver economy. That is our persons that are elderly now and really need our support and help. COVID-19 has really impacted on this audience, but there is tremendous opportunities also with every problem that arises. And if we look at COVID-19, we'll see that there are tremendous opportunities that have now arisen for solutions that will help these vulnerable populations. One such is Dr. Che, and I'll speak a little to how we engage with him and what opportunities exist for persons who are looking to drive. As it relates to the silver economy, there are more and more we realize that we will have to provide services, and the health and wellness industry provides tremendous opportunity to support these persons. And a lot of countries have taken advantage of it, and we also have the opportunity to do so, but using technology to leverage those solutions that could come forward out of it. Earlier at the beginning, when COVID-19 just started in March, we put out as an IDB Lab a call to innovators and technology solution providers to provide solutions for apply through, and he actually was selected selected as one of the companies to support, and we helped him with the AI aspect of the MD Link solution. And I'm happy to hear that that is moving great, and you know, we're moving towards that. But broadly, I wanted to say for the industry that there is a lot of technology solutions that are there that we can look at, which goes beyond telemedicine, that goes into wearables and digital sensors and remote patient monitoring and even virtual rehabilitation. And that is something that I think that provides a lot of opportunities and could be explored further. And finally, in my 10 minutes, coming out of COVID, IDB Lab has also launched another challenge that is looking at how do we help the tourism sector to pivot in this time of COVID challenges and to imagine tourism that will further enhance the industry. And we have we're still going through due diligence for a few of the companies, and there are a lot of persons who are thinking beyond what they're doing every day and thinking about how they can integrate new technologies, whether artificial intelligence, using big data because you collect so much data on your patients, and also for our patients. And I'll end there to preserve some of the time.
All right, thank you so much. There were a few instances where the connection got a little sticky. But I think by now, so many of us have been on Zoom calls and everything, we've kind of learned to, when it's patching in some instances, we learn to listen and understand in between the words. And thankfully, Dr. Bowen is also here who can also refer to some of the processes at the IDB lab where that would be of benefit has benefited him and would have been and will be of benefit to others who want to join the ranks of entrepreneurship in telemedicine. That both, Professor, you went to the IDB as well, Prof? Or you had enough money? Money wasn't a problem.
The fact is that our vision and mission were sort of different because we're focusing basically on getting a lot of data out of the country to see exactly what the needs of the country were. And because we knew that this was a long haul, you know, even though we got a grant and loan from the Scientific Research Council, this was not enough, and we knew that we had to do a lot of sweat equity and innovation if we were going to achieve the mission of universal access, using the telemedicine platform to give the Jamaican people and its industries universal and affordable access to healthcare.
Okay, excellent. So at this point, I will just open up to questions. Are there any online or in person? And if I'm not getting any signals, so I'm assuming, oh, there is a question, yes, from the floor.
I'm from Texas. I'm not from here. But I had a question. With dealing with technology and trying to do the health thing with elderly people or anything of that nature, I don't know if any of y'all have ever had the misfortune of trying to help an elderly person from a distance with technology. I wanted to know, is there a plan to utilize your youth to be able to introduce the elderly and even traveling abroad, the elderly that may be coming, you know, just coming on vacation with using your system? And is there a way that when we come from where we're coming from, there's information available to us to where we can be directed to, say, an MD link, which I personally used since I've been here. And I, as a 29-year-old, an adult, had a little technical difficulty with it. So I could only imagine maybe an elderly person having even more trouble. So I would just say, is there a way that y'all can utilize the youth who, you know, they have their head in their notebooks and in their little tablets, because those are the people who are gonna build relationships with people like me who would like to come back. because as the elders continue to age, well, technology is with the youth, so let's not forget, the importance of it.
All right, brilliant question. So technology by nature would be more bought in by the younger generation, and the ones who need health and wellness probably the most would likely be the older generation. And so the question is, how have you guys adjusted, adapted? What solutions do you have to fix that dilemma?
First of all, it's a very important question, and it goes to the heart of how you structure the development of your platform. First of all, every person who is an elderly or a child always has, in relation to the registration, a next of kin. And the next of kin is the person who will do necessarily the handholding. Added to that, there are a lot of patients who are disabled, who are deaf or dumb, who are blind, etc., who always must have a next of kin who is there to be part of the process of the clinical encounter. And that is where we think that it is very, very important. The other thing is that coming in the future, because we have done quite a number of tests using some devices, we can also use some Bluetooth devices, which could also be used to monitor patients and also to give signals as to how we engage them. But essentially, the rules are such that you have to build in those capabilities, because it is not, it must be user-friendly. Every item on the platform has to be user-friendly, and that is why we have just finished doing about 4.5 months of testing with our colleagues, with the doctors and the allied medical personnel, just to look at all the systems, how user-friendly they are, and we rate this, and if there's a problem, then we have to make adjustments. So it's a continuous system of adjustments and revision and innovation.
Sounds good.
Of the platform.
Dr. Bowen, you had a...
If I,
Sorry, Ms. Sigri? Sure, go ahead.
if I could add, and I hope you can hear me, so I'll speak slower. Technology adoption is going to be across the board, and finding ways to allow for, let's say, like older persons to be able to connect is going to be a challenge and something that we need to keep working at. But as Prof. Davidson mentioned, having that support system is important, and allowing others to help them. There are times we put the technology not necessarily in the patient's hand, but in the service provider's hand to help with the healthcare provision that is there. So that's another way to help with the adoption, not at the patient level, but at the doctors or the service providers.
Thank you. Dr. Bowen, I had offered if you...
Yeah, what I would say is the good thing is the technological divide in age groups is getting smaller and smaller. We've had patients as old as 75 come on, use our platform 100%. Excellent. No one at home and get service. So we know that, we are somewhere along the lines of user-friendly. And just like Prof said, user-friendliness is what it would come down to, making the platform as user-friendly as possible. And that can even take place by having, again, a nurse on stands to answer the call, to walk you through, to guide you through, to speak with you directly and tell you exactly what you should do to book your appointment. Or from the point of view of remote patient monitoring, again, with the elderly and the nursing homes, you can have a nurse or a medical staff take over the whole technological aspect of it.
Excellent. And that's our time. So I'd just like to thank our esteemed panel, Dr. Shay Bowen from MD Link and MD Lex, Ms. Terry-Ann Sigri from IDB, and Professor Winston Davidson from UTech. Thank you.
Doctor on call.
And Doctor on call in his capacity as a technological telemedicine product out there. So thanks to you for listening, and Thanks to the audience online, and I turn it back over